Dr. Mollica, one of my mentors for sure. He graduated from the University of Medicine and Dentistry in New Jersey in '83. Prior to that, he got a master's degree at Farley Dickinson. He's an author, researcher, speaker, Eagle Scout, and currently on the board of directors. So yeah, I think you'll love this, seriously. Dr. Mollica.
In our world in dentistry is changing, and you're here because you want to change. You want to do the best thing for your patients. And dentistry is changing. I see the world of dentistry where we love our mechanics. You're a great mechanical dentist. Oh, that crown looks beautiful. Oh, that onlay. Oh my God, that cosmetic's amazing. And that's a beautiful thing. That really pays for us to be here. But in a deeper sense, what's really going on? How are you really influencing that individual that we're working on? Now today I'm going to just basically tell you my story in a way, how I evolved into this world of biologic dentistry and how it evolved for us into a working model, which I'll describe to you. So what's important is, why are we here? We're all here for different reasons. And of course, like I said, for the betterment of our patients, but also how to better take care of yourselves. Now, dentistry is kind of an interesting world. We have these great, beautiful offices. The patients come in, lay out these beautiful treatment plans, and we go to work, right? We're drilling away. We're doing all this Mercury-Safe stuff, splashing mercury all over the place, infections, aerosols all over the place. Man, you live in an ecological horror show, by the way. You really do. I swear, I keep on telling our students, I says, you know what? You have a dental office. After 25, 30 years, maybe you can condemn that building, put it in a bio bag, and ship it somewhere. Because no matter how great we are with all these protocols, and we're, these safe things, and we protect the patient, try to protect ourselves, man, our aerosol world is tough. It coats everything. So we do the best we can. But what's important is, besides helping the patients, also to help you. But what's important to me, of course, our goal today is you got to feel good. It's one of the greatest questions. How do you feel? You have these patients, can I tell you my story? I say, here we go. Or I feel great. Even some days I go into work, I'm like, oh man, I feel crap. And the patient, how you feel? Oh, I feel fantastic. I feel great. And that's really important, feeling good. And of course, having fun. I've lectured with Bob Harris for years and years and years. We've done a whole bunch of cool stuff. And we said, you know what, when this isn't fun anymore, we're done. I even said that to my dear wife, who I practiced with in dentistry for 37 years now. We've been married 40. I'm surprised. I've missed some mercury toxicity. But I said, Karen, man, the day I walk in the office, and I said, this sucks. I'm out of here. Because the mind follows the body. We're on a pathway in life about healing. And this talk is really about healing ourselves in many ways, but also healing our patients. I don't know about you, when I went to dental school, man, it was just like survival of the fittest. Am I going to get my requirements done? Oh my God, am I going to get out of here on time? Am I going to escape jail after 4 years? Nobody talks about healing. How do we heal our patients and heal at the same time ourselves? So what's also important is, which is kind of interesting over the last number of years, this concept of biologic dentistry. What the hell is that? Over the years, I've asked one person, line them all up. Okay, what are you? I'm a biologic dentist. Oh, okay. What's that? I take mercury out. Okay. What are you? I'm a holistic dentist. What is that? I don't do a fluoride, I do it with mercury, and I don't know. I'm a physiologic dentist. Oh, what I do? Well, I kind of move jaws around, which are really cool now. What the hell does that mean? How do we define ourselves in this biologic world of dentistry? And we're going to kind of talk about that today a bit, okay? So, what is a biologic dentist? Well, let's see what that is all about if the slides progress. Oops, let's go back. I can't pass the gorilla. This is Griffin Cole before his facelift. But first of all, thinking in terms of biology, thinking biologically. As soon as you have that mind shift into the biologic world, things change around you. I'll jump ahead just a hair because we see patients with periodontal disease, all these complex issues. You know, we can try to treat them with antibiotics, ozone, which we'll talk about, all this kind of stuff. But why? I mean, remember, you know, age is not a disease, that's for sure. But why do these disease processes really emanate very deeply first, well before we see it, and eventually they emanate out, and then we're chasing what? Chasing symptoms. We're chasing symptomology. So when we think about the biologic model, biologic dentistry, over the years we developed really an integrative model, a working model in which to bring all these different aspects of the biology, which we'll talk about, into something that's coherent, that we're not all over the place, so we can define ourselves, because it's important as the future comes. How do you define yourself? I'm a prosthodontist, I'm a periodontist, I'm this, I'm that, I'm a TMJ specialist, okay? I'm a biologic dentist. What does that mean? And you must be able to really define that so people can understand what makes you special and makes it different for you. A fast trigger here. Click, click, there we go. So it's interesting over the years, going back when I was in dental school, you know, I was down in Newark at New Jersey Dental School. We used to get some crazy kind of things coming in. You know, the favorite thing was people shooting themselves, all kinds of interesting stuff. But things have evolved differently. You know, things are changing. Now, these are kind of probably the environmental influences that we have, lifestyles, nutritional changes, but our awareness and your awareness as biologic dentists transcend just the head and neck. Remember, in dental school, we never talked about it. Remember, nothing existed below the jaw. It had to be something carrying your head around. But now we know. I mean, is this a local or is it a systemic issue? Or is it both? Number one, there are no barriers in the human body, by the way. When you get in an infective state, and remember also, we are what? Well colonized. We have a strong symbiotic relationship with the bacteria in our ecosystem. And for 50, 60, 70 years, whatever it is, we've been trying to destroy, what, 90% of ourselves in numbers? And we're seeing the results of that today. So when we're well colonized, all those bacteria, their relationships with each other and their relationship with our mammal cells make a significant difference in our health and wellness. So when something goes out of balance, these bacteria are smart as hell. They're opportunistic. They can switch genes, they can switch genes on and off all the time. Something that we would perceive as very friendly bacteria, for some reason, gets pissed off, switches a gene on, and starts poisoning us. Those bacteria change and morph, a concept called pleomorphism, changing to their ecology, into something that's pro-life, or it can be just the opposite. Now, this is a well-infected person. There's a certain type of bacteria, virus, fungus, who the hell knows what we're growing, starts to emanate, and their poop and pee is what? That's what wears us down. The toxins associated with that. So we have to change. We're thinking biologically, what the hell's going on here? How can we change this ecology, this biology, back into a healthy model that can maintain itself? Not just some cleaning this up and scraping, cleaning it up, oh, let's give them some antibiotics, pack crap down in the gums, and that's the fix. The oral cavity happens to be part of what? The GI tract. It's one thing. We still know where the oral cavity begins, right? Very important. chewing food, mastication food. We start breaking down what? Sugars. We start breaking down fats. The tonsils are there, okay? The tonsils are already perceiving information. They do have a purpose. It's like the appendix. Oh, the appendix was nothing. No, it's a nesting area for probiotics. The tonsils directly talk to what? Gut-associated lymphoid tissue. The immune system. Where does your immune system live? In the gut. So when you're chewing food, your body is already talking to itself. And that's another important concept. Your body must talk in a clear, coherent way. Cells have to talk to each other in a clear, coherent way. Otherwise, you start to drift into the abyss. And a good ecology allows that to happen. So when we're dealing with issues like we hear about osteonecrosis of the jaw, we're dealing with different things today. Mainly dealing with pharmaceutical agents that all have what? Side effects. Now we have bisphosphonates. Fantastic. You know, how do we deal with issues like that? Well, bisphosphonates were designed as a chemotherapy agent years ago to, inhibit cancer infiltration, slow down cancer, and invading bone, all that kind of stuff. And they said, wow, the bone is getting denser. Let's use an off-label use to get it cleared FDA for osteoporosis and fake everybody out. You're getting harder bone. Well, the result, as you've seen, in cases like this patient was poisoned, literally. Prostate cancer, going to put you on some Zometa. And we make these things stronger and better, less ability to be broken down by water. Your body has to break things with water. Water, the being a universal solvent, hydrolytically breaking down these pharmaceutical agents and get them out. Well, in our infinite wisdom, we make them less hydrolytically reactive, and they become salted into the bone. And the result is any kind of little injury to the soft tissue of that, the patient becomes more susceptible to this type of injury. Now, in a case like this, we're trying to understand biologically what the hell's going on. How can we fix this? I've been on antibiotics for 6 months, and you have this. I think that's called insanity. What are antibiotics going to do if it don't work? If an antibiotic doesn't change you within a few days, it doesn't work. It certainly works in destroying your immune system because it destroys the microflora in your gut. And that interrelationship with your microflora and the immune system is absolutely critical to maintain. That's the offset on that. How do you fix that? How do you fix it? I've been showing this picture for years, but it makes the point. This is this gentleman's maxilla. Let's see if this laser works. Here is the floor of his maxillary sinus. Here's the alveolus. Let me tell you something. When he came in, he said, Doc, I go up there to clean this out with some of our ozone techniques, which I'll show you how we fix it with that. But and that bone starts to move. Like one of those, okay, what the hell is that? Yeah, that bone's been moving for about a week. I'm like, okay, now what? All right, well, it's kind of hanging out, so I'll get up there and explore and plop that hunk out and go, holy, yeah. But you know what? This is the innate intelligence of the body. The body was trying to heal itself, get rid of the dead, crappy bone. And this is one of my initial awareness about the innate capability of the human body to heal itself given the right circumstances and support. And that's the difference when you're talking about biology. Your job as a biologic dentist, beyond the beautiful mechanical things we do, is to understand how can we support that patient's innate healing processes and support that process itself. On extractions, surgery, cases like this. I can't go, you're healed. It was a few thousand years ago and ain't working now. But recognizing the biologic underpinnings of what the situation is. So this happens when you have poisoned tissue like this and you have dead bone. We call this dysregulated tissue. What does dysregulated mean? It's not getting the information it needs to heal. The vascular beds have collapsed down. The periosteum has collapsed down. The lymphatic systems have collapsed down. The energetic field of healing has collapsed and retreated back. We can take pharmaceuticals that the cows come home, which they've been trying for years, and this won't heal itself. But if we think in terms of, okay, if we can reestablish circulation back here primarily, get the lymphatic system going in, good blood flow in, good blood flow out, good lymphatics in, good lymphatics out, that supports the patient's healing process and using all the tricks of biology. In cases like this, we're using a multitude of different remedies, from drainage remedies, homeopathic remedies, vitamin C, nutrition, and ozone therapies to re-regulate that tissue. So we opened up all those innate healing processes and got that process here as this bone was evulsed. Once again, in this particular case, where you look up in this void here, you're looking basically at the roof of the maxillary sinus. But once this necrotic bone was evulsed, and we've seen this again and again and again in these cases, now the vascular beds are reestablished and the healing process can go on itself. And before and after itself. And this was a case in those days where I had a bad tooth. He went to the dentist, had the tooth extracted. Dentist didn't understand about Zometa. Nobody really did. I had a dry socket. Went back again, cleaned it up, made it worse. Then what do? Ooh, off to the oral surgeon, that's for sure. What did the oral surgeon do? We'll really clean it up. And boom! You know, and this is the result. Friends of mine have these health shows in Manhattan. Come on, Phil, come on in. So I come and talk about it. And my staff hates when I do these radio shows because the phone goes berserk and all the woo-woos from Manhattan come flooding out to Jersey. We try to set up barriers at the tunnels and the bridge, but man, they work their way through. Damn Port Authority. It's rough out there, let me tell you something. Forget about it. So even in cases like this, what the hell's going on? The patient had extraction 7 years ago. Still has a hole in her jaw. It's Lyme disease. I don't even know what the hell Lyme disease means anymore. Is it a tick bite, Borrelia, Ehrlichia, your mama, your papa? It's all these kind of co-infections. How do you hell you deal with that? How do you take these things, which I guess, surprise, we have it all. How do we take these things that have emerged out of the colonized state, we call now infection, how do we change the environment enough to bring them back into a colonized state where everybody's happy? You know, this Lyme thing with antibiotics, maybe you can catch it early, blah, blah, blah. But most of this stuff doesn't emerge for years. It's an ecological issue at that point. You've got to change the ecology that's not favorable to these forms. So in this case here, I mean, what do you do with that? Well, you can go in there surgically and do it, but that's infected, okay? And also you have to be aware with these infection cases, you hear a lot about cavitation surgeries. Ooh, I love cavitation surgeries. But a lot of them are 2 or 3 time losers. Why do these things not work a lot of times? Because remember, you see this, you see that ball sitting up here, this infected area here. Once again, 3D cone beams, awesome, right? Great technology, love it, okay? You see this 3D rendering, that's a 2-dimensional model. Remember, these infective sites are like spiders. They have multiple legs and wormholes all going around. It's not this little ball sitting there unless it's a perfect cyst. So when you go in there, you debulk it, but a lot of times, what do? You wind up leaving some infection behind and reestablish itself because the ecology hasn't changed, and here you go again. You're still infected. So think in terms of biology. Think about the dimensionality of these infections. Now, we can talk about in another time about ozonating these things and then doing surgery. That works very well itself. But here's a case where we're using ozone and other remedies, biologic remedies, that we're able to reverse this and allow this process to naturally heal itself. Number one, eliminate this infective state here, open up the circulatory system, get the immune system coming in here to remove this, and changing the pH. If you look at holes in bone, that's an acidic environment. And you see these holes being formed. Here's, very acidic. When you use certain remedies like ozone, these other different type of remedies, what you're doing is you're elevating the pH as you're eliminating the infection, and that allows for what? The remineralization to occur. Just remember, for all these minerals to come back in, these inorganic minerals to come back in, they're positively charged. Infection and inflammation is what? Positively charged. As you reverse this, this will allow, once the infection is eliminated, the elevation of the pH comes up, that allows for the remineralization to occur, and that's healing. That is healing. We go from that to that without surgerizing the patient. So how do you deal with this? This is from my friend Lou Travato. I don't think Lou's here. Lou Travato's down in Philadelphia. And I don't know if he has one of these weirdo magnet deals, but he has these crazy patients come in. Then he sends them up to me to deal with. So this poor patient here had squamous cell carcinoma, maxilla, emanated up into his maxillary sinus at the floor of his cranium. So he had surgically that tissue removed itself. And, of course, the follow-up radiation treatments associated with that. And he just was not healing. And he came to us to help him support that healing process itself. So here he is. He's have these wounds that would not heal. And the physicians were, it's kind of interesting, is that, well, you're alive. Does it hurt? Well, not really. Then don't worry about it, okay? So he had a large obturator there. So the sample I use is, this is the tissue that was up inside his cranium, right up there, up in the vault area itself. Burnt from radiation poisoning. Now, if you think, well, I'll give him some antibiotics. What the hell is that going to do? It's like I have a cold. I think I'll take some antibiotics. That worked out well. Okay? So how are we going to do? What's happening here? Well, we got damaged tissue. We have dysregulated tissue. We have a lack of vascularity. The blood flow has been collapsed back. Okay? No good information's coming in. The lymphatic system's dropped in. How can we start opening us up? This is where the biology comes in. This is where ozone therapy comes in, plus other drainage remedies, these other remedies, which we can talk about maybe a little bit down the road. But here, once we reestablish and recognize how we can support the patient's innate healing processes, this is where we start to see the vascular bed start to come back up. The tissue starts to regulate itself. The necrotic tissue is sequestered and pulled away by the immune system, and we get some nice healing in the area. And thank God he's doing well today. Thinking biologically. Thinking biologically. And this is where the end result of working with this patient. In biologic medicine, biologic dentistry, when you're dealing with issues like this, takes time. You have to be patient, take time. But that's fun. And we know, once again, the far-reaching implications now of these infective states and these diseases of the head and neck reach out through the entire body itself. Research has shown that again and again and again, okay? And so the problem we have today is different. We're dealing with drugs, dealing maybe with some aging, sleep apnea, these biofilms, oral hygiene, the nutrition we take. How can we support the patients, even with dry mouth? I mean, you have the patients come in, they bring in, I have two kinds of patients. One that bring in a bag of pharmaceuticals, and the other patient brings in a bag of what? Supplements. Okay? And I look at the pharmaceuticals, oh my God, this is the reaction to this one. I say, oh my God. It's amazing that they're alive. And of course, when I see these patients come in, I said, the first time they'll bring their bag of stuff, especially the pharmaceutical patients. I said, well, okay, you're taking this for this, this, and this. And how much water do you drink a day? Water? Oh, I have coffee a day. I have a cup of coffee. No, how much water do you drink a day? I have a cup of coffee. Well, why? You have so many aches and pains and your eyes are glassed over. I mean, you got to flush this stuff out. Okay? Hydration, hydration, hydration. I'll show you a few other questions we ask our interesting patients. So, Or the patient comes in with the bag of supplements. I said, okay, what are you taking? Well, this looked good, and I heard about that one. I took this one. So you lay this stuff out. They're taking about 6 pounds of vitamin B. They make great fertilizer. It's awesome. Less is more in biology. Less is more in biology. And of course, once again, the drugs we have to deal with today. That's kind of interesting with pharmaceuticals, isn't it? It really is. All these pharmaceutical commercials deal with bones and boners. It's unbelievable. Do you have an erectile function problem? Take this one. I'm going to go sit in a hot tub. Oh, my God. It worked. Oh, my God, I wore out too soon. Oh, what the hell. Easy. Bones and boners, man, that's where it's at. And I guess if you have skin rashes, that's the new thing. Just shut down that immune system. You'll be fine. But except you'll get cancer, your ass will fall off. Don't worry about it. Okay. So what's important is that when we're thinking in terms of biology, talking about infections that begin in the head and neck and oral cavity, a lot of crazy things go into our oral cavity. And of course, these have, once again, far-reaching implications throughout the entire body. So, all of these regimens have proven to be effective in treatments of infections, but of course, once again, side effects. I mean, we're talking over here, even in root canals over here, this is sodium hypochlorite, chlorine in root canals. Okay, it spills out, burns the hell out of the patient. Of course, Fosamax, once again, with that Boniva thing, these are side effects. We like things without side effects. Once again, bisphosphonates. How the hell do you fix this? How do you fix this? Well, certainly hopefully carefully take that implant-supported framework out and once again, clean up that infection. Is antibiotics going to work? Probably not, because they can't get in there. But this is when you do biologic therapies that can reverse this. And once again, thinking biologically and supporting the patient's innate healing processes themselves. So dentistry is interesting as hell. People come in with, they think it's a toothache. Is it a toothache? Is it muscle pain, ligament pain, joint pain, tooth pain, periodontal pain, nerve pain? That's usually a combination of everything. My tooth kind of hurts up here. And you look up there, oh, it's a perfect tooth. Well, when does it hurt? Oh, once in a while. And they have these big, huge masseters out here. I don't understand where my teeth hurt. Okay, all right. Stop weightlifting your, isometrics on your jaw. Okay. So, dentistry is a combination of issues. And with human diseases, they're really kind of broken down to some simple components themselves. Infectious disease, of course. Hereditary diseases, thank you, grandpa, grandma, of course. Genetic and non-genetic. Nutritional deficiency diseases, which we're seeing more and more and more. Food sucks a lot of times. Plus also the microflora, which I'm going to address more in the fall, has an incredible, influence on child development, neural development, overall health and wellness, and what we're doing that, trying to restore that. And of course, physiologic diseases, and of course, things that are communicable and non-communicable diseases. Anybody have coronavirus in here? You want to? Yeah, I know you do. I know. He thinks it comes from Corona beer. So of course, all these disorders are influenced. All these diseases, of course, are influenced by dental infection. That's why in the biologic world, as you evolve into this, I don't know if there's banners in the air or you send up, star shells, whatever it is. Once you evolve into this, you're going to get very, very interesting patients that have peripheral issues that if you don't clean up and investigate what's going on in their head and neck completely, not just the jaws, okay, it has a tremendous influence on their outcomes of health. I've been doing this for a very long time, and I've seen some miraculous things. I've seen, cases where, for a simple example, a girl came in from California, had one mercury filling put in. A few weeks, by the time she saw it, was probably about a month or so before. Within 2 weeks, she was diagnosed with multiple sclerosis. We came in, took out the mercury properly. She went in some chelation therapy done. Miraculous remission, it went away. Because, once again, it's a situation, her ecology didn't have the capacity to deal with those mercury toxicities, and it overwhelmed her system. And the typical medical model, what did they chase down is what? A lot of symptomology. We have extracted root canal teeth that are really nasty as hell, and not all root canals are bad, no matter what everybody says, I think. You know, bad root canals, take them out, infected tooth, and things change, much for the better. A couple of my favorites is take a root canal out, clean this patient. One root canal, beautiful, I don't understand it. This patient's coming, unbelievable, beautiful teeth. And one root canal, where the hell did that come from? Take it out, fix it up, nice, do all the voodoo that we do there. And I remember the girls coming, it's a couple of times this happened. They come in, Dr. Mollica, you got me pregnant. I'm like, oh, yeah. Is my wife here? Wait a minute. Things change. Cancers go away. It's bizarre. I'm not connecting it to it, but things happen. Things happen because we're looking differently at our patients themselves. So, of course, infections, okay, when we emanate out of colonization, we're talking about acute chronic infection. And a lot of times, the chronicity ones, you know, when I was in the orofacial pain world, we always said, when does something become chronic? I don't know. 2 days, 3 months, 90, you know. A lot of people walk around with chronic illnesses, have no idea why. It doesn't hurt. How many patients are walking around with abscesses or dead teeth and don't know it? Why? It don't hurt. Why are they going to come in to see you? It hurts. That's why they're coming in, and then you discover these other things. Well, it doesn't hurt me. Do I have to really deal with it? Well, you don't have to do anything. I'm just telling you, you better. Okay? And of course, we're talking about bacteria, viruses, fungal aspects, and parasites. Ooh, should we worry about parasites as dentists? I know Matt does. I don't want to bring that up, though. Yeah, entamoeba. Oh, there's all those different type of parasites in the oral cavity, for sure. But the interesting thing is, remember, there's a lot of combination of these things. It's not just a bacterial issue. What's one of the biggest problems with root canals, as we discovered as we were working on ozone and these things years ago? Fungus. Fungus amongst us. So we're dealing with a multiplicity of these different combinations. So it always amazed me if we were going to treat these pharmaceutically, okay, and we do, you know, combination of bacteria, viruses, fungus. We treat them with antibacterials, antivirals, antifungals, antiparasitics. We'd cure them. They'd be dead, but we cure them, okay? But there are alternatives to that itself. So how can we deal with these kind of mixed infections, the therapy-resistant ones? And that's really the thing today. These bugs, okay, they're not stupid. They can switch their genes on and off. They can smell things. They see that antibiotic coming. They tell all their pals, okay, they talk to each other, by the way, with cytokinase, okay? Cytokinase, the sacred language of chemistry. Oh, they killed a couple of our pals. Duck out, hide. Then sniff around. The coast is clear. Here they come again. And it develops to a chronic state. And this is where we built our integrative biologic dental medicine model itself. Thinking out of the box. Once again, defining ourselves. So when this model came out from years ago, we were at Capital University working on integrative medicine doctorates at that time. And I love the concept of integration because it's not a closed system. It's an open system of thinking where we put everything on the table, but what's important is developing your plans with your patient involved. The worst patients are the ones that come in, fix me. Time out. I can help you fix yourself, but you have to fix yourself. You have to be your own best advocate. So we define this as dental medicine that partners the patient and the dental practitioner to develop and integrate biologically safe, effective, established, and emerging treatment modalities that allows for treatment that is not subservient to any one school of dental thought. We put all medicine, dentistry, everything on the same playing field. And that's why it's so important as a biologic dentist to understand all these different healing models out there. It's amazing. All these different healing. If you have a sense of these different healing models, it might be just the right thing for your patient and help guide them. That's part of being a biologic dentist, to help them to help themselves. So when we take this integrated biologic dental medicine, we're taking holistic principles, biologic principles, physiologic principles, mainstream stuff, okay? We still, get our allopathic stuff in there, and integrate it, okay? And apply all those principles to where they're needed for its particular patient. So we're customizing the needs of the patient. And you're going to have patients that come in that are taking all these supplements and all this different type of stuff, and they don't know what the hell they're doing. And they're trying to cure their cancers, their diabetes, their chronic fatigue. They need guidance. And as you interview them and talk to them, you have a sense of what their needs are, other than cleaning up the head and neck, okay? But what's the biologic underpinnings, and how can you direct someone on the medical end, per se, to help guide them and work as part of the team to get them well and functional once again? So, all these principles can be applied to diagnosis and the treatment, of course, to human disease themselves. And once again, what's very important, you are but one thing. Your body doesn't understand its nose, its ears, its feet, its toes. It understands itself as one thing. It is totally unified. When you pick up a needle, we'll describe that as we get to our second part of the talk. You stick a needle in somebody's face, which we love to do, okay? The little toe feels it. There are no separations in the human body. You are but one. So, integrated treatments, of course, can be antibiotics, antifungals, antiviral, parasitic, antiseptics, essential oils, homeopathy, lasers, ultraviolet, and of course, we're going to talk a little bit about oxygen, ozone therapy. So it's a combination of these, and it transcends that list even further, for sure. So, setting the stage like that, what is the biologic patient? What can we expect from a biologic patient? And who are they? Well, I see a lot of very health-conscious patients. They come in, they have these mercury fillings in there, they have, some different dental issues. They want to get healthier, they think that can, guide them for longevity or the case. So you have the healthy person who just wants things better, which is great because those are easier to deal with. You have the very sick person who their physician, integrated practitioner, foundational, whatever the case may be, recognizes that, you have a lot of oral issues. A lot of issues in there, infection, et cetera, that have to be addressed. You have the ill person. And we see those all the time. And then you have my favorite, the woo-woos, okay? The ones that sit out there with the pendulums, okay? They have to make their appointment on a certain astrological moment, okay? They have tachyon beads. They come in before their visit. May I come in and visit the office? Okay. Oh, very nice. The energy's good. I'll keep my appointment. Oh, thank you. What are you going to do? Go with it, man. Go with it. And there's what I call the traditional patient. The patient, hey, I heard you're a good dentist. I'm coming over. Oh, okay. And then, you turn their ship, okay? Those are new patients. And each, once again, has their own special needs. And they can all be, and they are, really, really great patients. So, what are they looking for? Well, they're looking for better health, okay, less toxic exposure. And you heard the story about fluoride, you heard the story about mercury and all the other wacky things we do in dentistry, okay? So they're looking for a better part of their health program. I get athletes, I get all kinds of, from Manhattan, a lot of Holly weirdos, and I want to be healthy, this is always another great question. When I think about health and wellness, you know, I have some of these kind of Broadway-ish people come out, and they're looking in pretty good health and this and that, these models and stuff, and they, I says, okay. I said, you know, part of our interview process, you know, we talk about the water thing, and I says, okay, do you take a poop every day? Take a poop every day. You know, it's just part of, you know, I know if you're taking a crap every day. Just one of my things. No. I go once a week. I go twice, you know, once every 2 weeks. Man, you're full of shit, man. You got to do something about that gut. I don't feel good. I had headaches and this and that. You're taking a crap every couple of weeks. What do you want? So these are some of the issues, you know, you delve into. What, you know, what's health, you know, what's wellness, et cetera. You know, they're out there. Remember, one of our mantras at our school, you got to what? You got to poop good to what? Look good. Okay, poop good. I'm serious. That's why I look good. No, okay. Anyhow. So they're, of course, looking for solutions to their issues, their chronic illnesses. And the toughest ones are, I know, this is the ones I'm getting lately because of the internet. I know I have a cavitation. I know that's the cause of everything wrong with me. And I'm like, oh, brother. Okay, well, let's take a 3D cone beam, blah, 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 take a look. And the bone looks awesome. I know it's there. I'm telling you, you don't have a cavitation, okay? But something else is wrong with me. Let's talk about it, okay? So a lot of times they're focused on what the hell their problem is. Now, if you can find some issues, fantastic, okay? And you can work it through how you're going to do that. But if they're like, I know this is it, you know, reduce their expectation because I think the miracle cure is coming because you cleaned up their head and neck, and it might because also they have a lot of work to do after that. If you get rid of all this toxic crap, guess what? It's all over the damn place. It takes time to get rid of it. This is where detoxification and making sure you're draining properly. You know when you hear, I'm draining properly, what the hell does drainage mean in your body? You'll hear this again once you get into this beautiful world. Well, you're crapping, you're peeing, you're sweating, and you're breathing. That's how you get rid of stuff. Okay? You have to eliminate that, you know. We're beautiful, we're biologic, we do all these wonderful things, but you know, some metabolic byproducts you got to get rid of. If those pathways are not open, and you do all kinds of voodoo to get their drainage going, and they're not crapping and peeing and sweating and breathing, they're going to get sick as hell. So they are looking, you know, for causes related to the general health status. And well, you know, hey, I heard this was really good. Yeah, it's good for you. So, you know, what are they really looking for? And these people do their homework, which we'll talk about in a minute, you know. They're looking for a dentist that understands biologic concepts, understands these different biologic therapeutics, understands different healing systems, because that's what they're doing. I'm doing Ayurveda. I'm doing homeopathy. I'm doing Chinese medicine. I'm doing acupuncture. What the hell does that mean? How is that influencing what you're doing also? I'm detoxifying. Understands integrative alternative medicine as it relates to what we do. There's a huge, huge population out there that looks for biologic dentists that appreciate these things. It's unbelievable. You will never be unbusy, believe me. Understands the concept of detoxification. And these are important questions to ask these people. You better find out what the hell they're doing because they're all doing kinds of crazy stuff. They're guided or unguided. You know, a lot of these patients think that taking herbal medicine is a supplement. Herbology is medicine. It's taken for a specific reason for a specific time. Supplements are nutrients, some vitamins, minerals, and stuff like that. So there's a difference. Understand, because this can influence it. Someone's taking, I take ginkgo for my brain. Oh, that's good. Oh, that tooth's got to come out today. Why can't I stop them bleeding? Well, it's a blood thinner. I'm taking willow bark. I had a headache today. Why can't I stop them from bleeding? That's aspirin, salicylic acid. So these are little subtleties you learn about. Understanding biocompatibility of dental materials. These patients, they ask you, like Clifford reactivity test, the other test. You have to match these materials up. That's part of the options you give these patients. Over years, you recognize and have materials on that really work well, that you've never seen really react with people. But there's always the one out there. So you want to do this test? Beautiful. And those tests are great. To me, not so much specificity, but gives me a trend in what these patients can handle, okay? Understand, foundational nutritional concepts. There's all kinds of crazy-ass nutritional programs out there doing all kinds of things, getting a sense of what's going on nutritionally for these patients themselves, okay? Understanding supportive therapies, homeopathic remedies, nutritional support, supplementation, etc., as it relates to your biologic dentistry. Understand what are safe protocols. People do extreme things. I have patients, I'm kind of the ozone guy, that love to talk to me about rectal insufflation. Okay, taking gas, putting it right up there, wonderful therapy, but it's not where you hook your butt up to the machine directly and sit on it for half an hour. You can probably play Dixie once you let the gas out. But more importantly, some of you got that. Anyhow, and understand them. Because, I went to the other dentist and he looked at me like I had three eyes and I was nuts and everything else. And I'm saying to myself, I can understand that, but I understand, that's okay. And it's good because they turned out to be pretty amazing patients themselves. Okay. So, why were you blessed? Why did the blessings come upon you that they want you as their dentist, hygienist, assistant, etc.? Well, you're a member of IAOMT, fantastic organization, incredible reputation for years, great science, great support, incredible community. You were trained, knowing what you're doing in this particular area. My best patients over them, we never got into advertising, word of mouth. That could work for you or against you, okay, word of mouth. Are you board certified in this particular area? Or you're nice, we like you, you just happen to be nice. And do you listen and learn? I've learned a tremendous amount from these patients, and it could be a combination of these things, maybe none or all the above. But you were blessed, and this is why you must prepare for the quiz. The woo-woo quiz. It comes to you. So be prepared with these patients, and this is important. When I was trained as a dentist, mechanic, you get do a procedure, you get paid, your time has value. The $50 examination, throw it out the window, okay? If you're going to spend an hour with these patients, charge them $300, $400, whatever the case, and they're happy to pay it because you are going to spend the time with them and listen to them. They go to their medical people, unless they're going to an integrative practitioner, a functional person. Let's say, okay, take this, see you next time. You have 5 minutes. Sit down and spend the time with them. Put the time aside and charge them appropriately. They're happy to write the check, believe me. Don't get hung up on that insurance crap. So be prepared to spend time interviewing the patient, okay? Be prepared to answer the questions. The question sheet comes out. Okay, you might have experienced this. It comes out. I have some questions for you. Really? Okay. That usually happens when, you're treating them anyhow. Okay, we're all set for today. Thank you. I'll see you next time. But I have one question for you. Yes. Rectal insufflation, no. Anyhow. Be prepared, to spend the time, explain the procedures to them and repeat it. Because sometimes over their head, okay? And be prepared to understand, the healing models. They're doing, like I said, the Ayurveda. They could be doing Chinese medicine. They could do a multiplicity. I'm doing a series of homeopathics. I'm doing a series of herbals at this particular time. I'm doing energy medicine, okay? So I'm moving my chakras around. Okay, beautiful, and it's true, okay? So try to understand and appreciate what they're doing. Make note, if you don't know what the hell they're talking about, don't like, oh yeah, I got that. Check it out. And be prepared to, answer questions like, how do you feel about colonics? Well, they feel pretty good, right? They're good, okay. A lot of people do colonics. I'm taking some drainage remedies, for my gut. What do you think? And they'll bring them out. So you want some familiarity with these particular protocols and procedures. So it's also important to integrate them. And also getting a list of what they're taking. I have some functional people and friends of mine that do this. They have a list of stuff. And you have to take that list and look at it and see when you're doing their mercury removals or whatever you're doing, if you have to plug in certain little holes for yourself or your particular procedures itself. And be prepared to question the patient on what they're doing. And this is critically important. You got to dig into that. What are they doing now? And they'll be happy to tell you their story. Are they detoxing at this time? Are they doing a series of herbals, homeopathics? And what are those things? Before I start digging away, popping teeth out or whatever I'm doing, I want to see what the hell they're taking and why they're taking it, okay? There's a million different remedies and stuff out there. Find out why, okay? And of course, the specific alternative protocols that they're doing. So, and the biologic patient, they do their homework. The internet, they're in there searching you, looking for you, talking to their friends. So they check you out before their visit, okay? And of course, like I said before, they check out, your office. Is it calm, professional, good energy? No, right? All that. They look online, YouTube websites, those stupid evaluations, okay, which everybody has 5s, okay, until the trolls get in there, okay? And then they quiz you. They test you out. They ask you all different type of questions. And you're like, oh, that's crap, that's this and that. Whoop, off they go. But once you adopt and understand these patients, I tell you, you'll get a lot more and you'll be blessed even further. So most are not nuts. Some are, but we all are crazy, okay? And just go with it and just learn and you'll have a series of fantastic, great patients to say the least, okay? So in summary, with this beautiful experience, the patient experience, it's all about, having fun and being friendly. As you know, being in your office is kind of like your second home. And I like to have fun, relax, nice environment. Patients drive you crazy. I had a patient, was it yesterday? I think I tried to block this out. So, wonderful lady comes in. We did the examination on her, and she told me her crazy, upregulated neurologic system, that it's toxic, I'm going to die, I'm going to do this. I said, well, if you're going to die, what the hell are you having your dentistry for? Well, I'm sort of not dying. Okay, all right, I got you. So great. And, and of course, we went through the crying and all this kind of stuff, and I'm like, oh, God. So we settled down, developed a nice little treatment plan. There's a few amalgams in there. She had one tooth that had to come out. That was exciting. But I'll give you the simple version. So I have this one, of course, upper left, 15. I have to take an amalgam filling out. I'm going to just do one. Now, I can't use amides for anesthesia, so I have a formulation of Procaine, which is an ester-type bond, 2%. I get her numb for a quick period of time, And I know she's numb as hell. And, of course, we set everything up. She can't have a rubber dam, so I use this cleanup with all this other stuff packed around it, claustrophobia. I go there and place the drill in and turn it on. Ah! And she screamed, scared the hell out of us. I said, that hurt. I haven't touched anything yet. You sure? Yeah, well, it was my nervous system. I'm like, oh, great. So, go back. I just, okay, She says, wait a minute. I have to get myself into a delivery position. What the hell is that? I'm not going to have to adjust it. What the hell's going on? So she put herself in one of her legs up in the, I don't know what the hell it was, but we got through the process. So thank you. You need 8 weeks off, trust me. I want to come back sooner. I need 8 weeks off. That's the entertainment you have to have. You go out of there, oh my God. Anyhow, but you go back for more. So anyhow, so that's part of having fun. You know, being informative, okay, doing your homework, understanding these different things, and you can support and really help the patient. You know, being a resource, you know, helping them, maybe referring them to a couple of different practitioners that can support what they're doing so they know what they're doing and getting better. Of course, you know, the typical stuff, being somewhat on time, organized, neat, clean. That's for sure. They'll go around, you know, are there any Corona laying around, you know? Okay. Listening, of course, and learning, and respect their time and give them time. And adjust your fee for the time, once again. So, a concern for their issues, you know, there's pain, discomfort, aesthetics, biologics, et cetera, those whole plethora of things that we deal with day in and day out. And, you know, I learned years ago about pain. You know, whether pain's real or perceived, it's real in their mind. And I, of course, learned that yesterday, again. Anyhow, so communicate their goals and how you can really help them in unique and different ways. And this is why you're here learning, because you can help them in very unique, in different ways that the typical dentist won't or doesn't know how to do. You know, we can only do things that we've learned how to do and incorporate in an intelligent manner into our practice, okay? And really what's important is, once again, recognizing and appreciating what they're doing and supporting them through the craziness. And you'll have a very, very, very productive, good practice for sure. How are we doing on time? 2 minutes? Oh, we got 10 minutes? Okay. So, good. So now that you're all running out of the room, and I wanted to become biologic dentists after that, okay? So we're here. It's going to go down to the rabbit hole, have some fun. So we're all seeking the truth. And truths today maybe could be different truths tomorrow, but we are seeking the truth, especially in dentistry. Dentistry is an incredible profession. You know, I was in anatomy school for 2 years. It was great hanging out with dead people, no problems. They just laid there and sacrificed everything. Okay. And my dear wife, who was a toxicologist at that time, and as a matter of fact, the anatomy program was housed at a dental school. Great. So we taught anatomy to dental students, and I had an option at that time whether to go to medical school, PhD program, or dental school, and I didn't know really what the hell to do. I was having fun with dead people, doing histology, kind of cool stuff. And my dear wife, like I said, wanted to go to dental school. We weren't married at that point. I said, well, okay, I'll apply to dental school. And we both got into New Jersey dental school and got married 2 weeks before dental school. So we had a 4-year honeymoon in hell, okay? But 5 kids and 4 grandkids later, things are still working out, but she has all the money, so I got to behave myself. So there's certain truths we have, and our truth system translates into our daily life. And of course, going back to Buddha, you know, there are things that cannot be long hidden, the sun, the moon, and the truth, and that's what we're seeking. Truth in dentistry, and really truths in ourselves. And our truths in ourselves really revolve around our relationships with our friends, acquaintances, family, our profession, you know, our personal selves, okay, which we deal with, we talk to ourselves a lot. Our wealth, of course, and wealth is kind of an interesting thing. Is wealth all about money, or the wealth of your life and what you do? And our perception of the world, okay? Positive attitude, because remember, when you heal, and we're always on the path of healing. How does healing occur? You know, and the model that we think about, you know, healing occurs on multiple levels. The physical, of course, we're always trying to keep healed, but also the mental component of healing. The mind has to heal, but also what's very important, the spiritual aspects of ourself, which is the ultimate driver in everything, okay? So mind, body, spirit, emotions are all part of the healing process. And this is important that you understand and appreciate as you're guiding your patients and yourself to health and wellness. So we love the truth. And of course, once again, how do you perceive the world and how do you feel? Some days we feel crappy. But you know what? Because my patient says, how do you feel, Phil? I says, I feel great. I woke up this morning. Awesome, man. Okay? I was at a World Jamboree of Boy Scouts, and I was honored by the Muslim community, which was pretty amazing to me. And I saw something on the wall there. And there was a sign that it said, someone will not wake up today. So don't complain about your life. Okay? So how do you feel? You feel great. And you're all feeling great because you're here today having a good time. Having a good time. Anyhow, and of course it's nice to have friends with like minds. And this is the beauty of IAOMT. You got people that share themselves. I hate I should say this in a certain way. I hate real dentists. I can't say it any other way. You ever go to like a real dental meeting? Oh, my dentist just drive me crazy. You know, oh my God. I used to lecture at these ADA things for the oral facial pain community, and it used to drive me crazy. Thank God I've transcended away from that. So having good friends. And that's a picture of Darla, our female bulldog, who we actually voted off the island. We had 3 bulldogs, and she was voted off the island to my daughter, the chef, up in New York State, because she kept on biting Henry. You know, it was interesting with their love triangle. I had another bulldog, Tankenstein. Now, Tankenstein, if he was like a guy, he'd be like a porn star. This dude was jacked, okay? He was built in many ways. So when poor Darla went in heat, of course, Tanky would go berserk. He would go, oh man, this is it. And she'd see him come and she'd sit down. I didn't have nothing to do with that boy, okay? But she loved Henry. The problem with Henry had something removed. So Henry had no idea what the hell to do with her. So I think this is where she had this hate for him. And anytime she sees him, she likes to bite him in the legs. So we voted her off the island. But guess what? She just came back. My daughter, the chef, got a job down in Jersey now. And guess who came home? Darla. So we're dealing with Darla now as we speak. Well, they are actually. So, in a deeper sense, other than having fun and all the cool stuff, talk about 7 core principles of integrated biologic dental medicine as far as healing is concerned. Now, I'm getting you away from the mechanics and all that stuff. That's okay. Let's think in a deeper sense, okay? Deeper sense to transcend yourself a little bit differently unto itself. We talk about different principles here. We'll start out with empiricism. The things we can't explain, how they work. Traditional medicine, going back, and that kind of is an interesting term. They use traditional medicine and allopathic today, but traditional medicine really based everything on empiricism, what they saw. There was a real art to medicine at one time. These physicians would have a sense, an intuitive sense of what's going on with these patients. Today, it's all diagnostic and testing and everything else. There's a whole removal thing. So it's a scientific discipline that concerns itself with the purity of clinical observations concerning the sick. And this is important for you because as you're sitting there, look at these patients. Just don't sit there and just listen to them, not even pay attention. Look at them. There's a whole story to being told other than what they're telling you. They're telling you their perception of their reality, but you can see, looking at these people, some other signs and symptomology. Open yourself up to that empiricism, that empirical look itself. The integrated dental model, as empiricism, recognize the absence of experimental validation. Not everything has to have double-blind studies, which most are fake anyhow, okay? We doubt our validity of our observations. But, with clinical associations, mostly have preceded establishment of experimental evidence. I mean, that was like for B12, we never understood what the hell that was, a related intrinsic factor. Even oxygen, ozone, homeopathy. Oxygen ozone, was used since the 1800s. Didn't know how the hell it worked. Now we know. We took empirical results that people got better, did all these amazing things. Infections went away, circulation, all these wonderful things happened. Didn't understand why. Now we have the science behind it. Same thing for homeopathy. Homeopathy, the name is changing to nanopharmacology because we understand the relationship of frequencies and information imprinted into water and how the science behind that works. Things are changing. The science behind that change. So empiricism is a wonderful art. Don't forget about your gut instinct itself. And the principle of integration. This is why I love this model so much, because it's an open model. It opens yourself up to all kinds of study and thought. It requires that the practitioner integrate in the care of the patient all that is safe and effective, once again, without any subservience to any one or more schools of medical or dental thought. If you become so locked in, okay, some biologic people are like that, I call them biologic zealots, that might work, but keep yourself open and don't poo-poo everything. Listen, the first time I was exposed to oxygen ozone back in, 97, 98, I said, that stuff will kill you. Oh my God, this is crap. What an idiot. I took the time to understand it and develop it the way it is today. So be open to all different types of integration of health. And a lot of times people need different things combined together. Combined therapies are critically important itself. And this is important because when you develop and or understand synergistic or complementary therapeutic protocols, and this really applies to when you develop protocols, procedures for detoxification or supplementation or supporting for the therapy, that the supplements, the herbals, or whatever the case may be, that you're putting together are synergistic, that they're all moving in the same direction. You can't give different herbals that are bringing you up this way and one that is dragging you back that way. Superoxidative therapies as you're massively putting antioxidants in at the same time. Synergistic therapeutics moving along. And this is when you learn about that, you can recognize what's going on when these patients' protocols are going on. So the efficacy of these integrated protocols, it's not really on the individual therapeutic, just that one thing, but it's the combination of the therapies that really give you that ultimate outcome for the patient. It's like when you take these herbal formulas, okay, these great, I use a lot of German herbal formulas. Pharmaceutical houses look for what they perceive as the active component within that plant. But the reality is the entire extract, all those subtleties within that plant itself, that's really where the outcome comes. So it's all those things synergistically moving along that really help the therapy to move along in a proper way. And thinking about the principle of integrity of the cellular tissue ecological relationships. Are the cells talking to each other? Uh-oh, he's creeping up on me. It's all about ecology. We'll stop here. I'll go back to the slide after our break.
Perfect, thank you.